Good morning or afternoon or evening to everyone who is on our webinar, depending on where you are in the world. My name is Amy Kerr. I am the Director of Recruitment here at WorldWide HealthStaff Solutions, and we are thrilled to be hosting this webinar today about National Healthcare Corporation with National Healthcare Corporation. I'd like to introduce Maria Wong, who is the Director of Workforce Development for NHC. And we also have with us Kimberly Cole, who is the Director of Case Management for our nurse aides and special visa types. So we'd first like to introduce you to National Healthcare Corporation through a video that is celebrating their 50th anniversary.
Hello, my name is Steve Flatt, and I'm the Chief Executive Officer of NHC. 50 years ago, Dr. Carl Adams founded our company on his calling to provide quality health care and improve the lives of seniors. Our calling to improve the lives of others is what makes NHC who we are. Our vision for caring in a better way day by day is brought to life by each of our NHC partners in 10 states across the country. Our key to success over the past 50 years is bringing talents from all disciplines together to deliver the best quality care for our patients, residents, and their families. As a leader in senior care, NHC has developed the most comprehensive continuum of care. We provide skilled nursing, rehabilitation, long-term care, home care, assisted living, memory care, hospice, and inpatient geriatric psych services. We invite you to join us today in celebrating 50 years as a company, committed to improving the lives of those we serve. On behalf of all our NHC partners, thank you for giving us the opportunity to provide care to you and your families for the past 50 years.
All right, that was really, really great. So I know that on this call, we have some folks that have already been hired by National Healthcare Corporation, which is really exciting. And then we have some other folks that are applicants and really interested in learning more information. So I think for both of you, either if you've been hired or you hope to be hired soon, we're going to let Maria talk a little bit more about National Healthcare and all the great things and why you would want to work at NHC. So over to you, Maria.
Thank you, Amy. I am so excited for this invite from Amy to share about NHC. I have to say that when Amy said about having this session today, my first thought was who would be the best one. But then I told Amy that I'm going to be the one. And the reason why is there is no better testament about a foreign workers making a life in the United States than me. I started with NHC about 30 years ago. And yes, I started when I was 10. Just kidding. But anyway, I started with NHC 30 years ago. As a foreign worker, I came into the United States with an H-1B visa. And one thing that the reason why I said yes to NHC when they offered me a permanent position was because of the fact that the founder, and Amy, can you slides, or do I do it? Okay. The founder, Dr. Adams, was all about care. He started NHC with the mindset of helping the geriatrics. And one of the quotes that he has is that nobody knows the quantity of their life. I don't know how many days you have on earth, nor does anyone else except God. What I'm most interested in is the quality of life while they are here. That's the business that we're in. So NHC, from its very beginning, have always been about the quality of life of our patients. And that's the reason why I signed up for NHC. And that's the reason why I made a career with NHC. So NHC's mission is NHC is committed to being the senior care leader in customer and investor satisfaction with a vision of caring, next slide, caring in a better way day by day. And we have values, and the values is how we select, and it's also how we say, oops, you're not the right one for our company. The 4 core values of NHC has an acronym of CARE. So we have commit to godly excellence, act with compassion and integrity, respect and value people, and there you go again, enhancing the quality of life of the patients, quality of life. Next slide. So just like what our CEO, Steve Flatt, have said in the video, NHC has a small field, but it's a very robust company. We actually have a lot of subsidiaries, but our key business is the skilled nursing centers. And like what Steve Flatt have said, NHC basically provides pharmacy, assisted living, management services to other skilled nursing, accounting and financial services to other skilled nursing in areas that were not in existence as far as skilled nursing. We have home care, we have care as hospice, and we also provide rehabilitation services, not only to our skilled nursing centers, but we also provide rehabilitation to hospitals, to jail, to school systems. So we're out there. So if you're looking for a company that can sustain with all the changes in the environment, in the workplace, NHC is the company for you. Next slide. We are all over the Southeast, Missouri, Kentucky, Tennessee, Virginia, South Carolina, Georgia, and we have Florida centers that we're managing. Next slide. And the way NHC has been organized is that NHC as a company has been divided into 7 regions. And these 7 regions have about 10 to 14 locations in each of them. And it's managed by a regional vice president. And that's the reason why that we may be a big company, a $1 billion company, but it's actually have a small field because you don't have to go through a lot of red tape because the management is at the regional level and then it's at the center level. I'm sorry, I'm gonna call. So anyway, sorry. And next slide. So NHC, just like what I talked to you about, is about enhancing the quality of life of our patients. And that's the business that we're in, is care. Thank you, Amy.
All right. Well, you can see there's all kinds of things that are going on over there. Everyone's so busy.
We have a new phone system that they're adding, so I'm sorry about that.
Well, that's real life, everybody.
Real life in America.
Yeah, that's real life. Okay, Maria, thank you for taking us through those slides. There's some things that we'd like to learn from you. So I have some questions, and I think questions that lots of our nurse candidates often ask. So tell me, Maria, and you talked a little bit about this, but what do you love about working for National Healthcare Corporation?
Okay, so when I hear that question from you, I'm thinking about from a personal perspective, and what I love about working for NHC is truly the focus on patient. It's about the patient. Everything that we do revolves around the patient. That sounds so like people say that all the time, but in reality, NHC, that's how we live. And as a person, from a personal standpoint, I have always been in the mindset that everything I do has to connect to God. And so I see my work with the patients, my work with the partners, connecting with with what he wants me to do here.
Yeah, so real mission-driven work is what it sounds like. And aren't we all lucky if we get to do that sort of work, like where you really feel like there's a mission and a purpose? What's the one thing that you would want nurses to know about national healthcare? If everyone forgot all the other things, but they remembered this one thing today, what would that be?
Two things, actually. Can I say two things?
You can say, I'll let you say two.
Okay, good. One is you got a commitment. NHC is not just looking for a warm body to plug in. We're looking for people that will commit to really, truly driving that quality of life and loving our patients. So you got to commit. The second thing is that as a nurse, if you're looking for just a job, NHC is not the right one for you. If you're looking for a career where you can place your hat and grow, NHC is the one. So commitment and career.
Okay, great. And then in a difficult year of 2020, NHC was awarded both the Customer Approved Award and the Employee Approved Award. Will you tell us a little bit about what it takes to win those awards and what it means to NHC to have won them?
Yes. So NHC believes in leadership. And leadership for us is not just at the corporate level, but leadership for us is every partner, we call each other partner, every partner is doing their job exceptionally well, leading themselves exceptionally well in loving the patients. We believe that if you love on the patients, the rest would follow. Our NHC mission statement of we're committed to being the senior leader in customer and investor satisfaction. We know that there has to be that if our focus is on the patient, we're going to get the financial rewards that brings with it.
Awesome. And I'll just say, Maria and I have partnered for a little bit of time now. And I think that NHC has the same philosophy about their employees. You can tell just in working with them and as Maria's planning on having all these international nurses and nurse aides come to the US, that's something that's really important is how everyone's going to be treated when they get here. So I want to mention that because you can feel that in this partnership, how important it is to them. Okay, let's get to the real important stuff, Maria. Yes. What are the benefits like? So everyone that gets hired at National Healthcare, everyone has a wage that is calculated based on their experience. So if you are currently working at or have been hired by NHC, you have that information. But tell us about everything else. What are all the good benefits that you can expect?
Yes, so we have the basic benefits as for full-time employees, the dental, the health insurance, the time off, all that stuff. But the two most important thing is, and I have two. One, I said to you about career. The career development is great with NHC. The tuition reimbursement that we have, we pay for you to make yourself better in how you care for our patients, but we pay for you to also become better in your personal life. So we actually have people that used to work in the dietary as a dishwasher that are now regional nurses. I mean, can you imagine that? That doesn't happen anywhere, but I think just NHC. So that to me is a great benefit. The second one is our 401k, our retirement plan. NHC truly invests on the people, not just now, but also after. So for every dollar that you put in, NHC actually matches 50 cents. So we have partners that were making minimum wage that are now retired and has a life that is awesome and they can enjoy it. So two things, the career development, which is a tuition reimbursement, and the 401k, the retirement, are the two best benefits for NHC.
That's awesome. I mean, we all want to have a fantastic job for a while. and then we all want to retire. So that's really important. Also, Maria, for people that are going to come to the U.S. and they've got spouses or grown children, one of the things that we've talked about is other opportunities at NHC. Will you talk about that for just a second?
Oh, absolutely. So NHC basically the way we manage our workforce is that we have multidisciplinary team members. So we have team members in the dietary, we have team members in housekeeping, in recreation, and in life enrichment, and all that stuff. So when you have family members that come here, there's two things that can happen. One, if they would like to work for NHC, we probably have a position for them somewhere in our organization. If their skill set is really does not fit with NHC, we have amazing administrators that actually have a lot of connection also in the town that the NHC is in. So for most likely, our administrators can help your family members, your spouse, find a job in the community that you live in, because they're a big presence as far as in the community and civic area where the center is. So two things: we can find you a job within NHC for your family members, and we could also help you find a job in the community. Is that what you?
Awesome. Yeah, that's great. Okay, so we've talked a lot about facts about national healthcare and mission and vision, but tell us, Maria, what is the spirit or the culture like inside a national healthcare community?
Yeah, so it's a loving and it's family oriented, and it's not perfect, just like in families, right? There's always sometimes, but at the end, the culture is that it's all about the patient. It doesn't matter what you do. It doesn't matter as far as how high ranking you are in the company. The focus is always on the patient. We have administrators that are sometimes, when things during COVID and even after COVID, take off their suits and work the floor as CNAs, because before they become administrators, they actually have to go through our administrator in training, and they are CNAs. So we have DONs that do the same thing. We have regionals are doing the same thing, even our CEO. So I think that's one thing that NHC have been consistent for the last 50 years, that it's all about the patient. So the spirit, it's care. Just really, we stay true to what our business is, which is care.
Yeah, and I think one of the things that I think is really neat, the National Healthcare Corporation page on YouTube has a whole bunch of different videos, and there's videos for a lot of the different communities. So if you have an assignment at a specific community and you'd like to see that in a video, go on over to the YouTube page, and there's some other videos where you can see inside different communities. So if you'd like to learn more, go to the YouTube page and watch some of those videos. I think some of them are really fun.
Yes.
So my last question for you, Maria, you talked about the different regions. So there's several regions that are in the southern part of the U.S. There's a Missouri region. There's a Northeast region. If you had to describe what was great about living in each of those regions, what would it be?
Yes. So I thought about this, and I thought, so I live in the southern region, and if there's one thing about the southern region is the fried foods. And that's really, I can get fried chicken, which is my favorite, fried pork chop, my other favorite. But really, the southern region is so loving. I don't know. It's family. It's home for me. And it's different because, I don't know. Anyway. It's going to make me cry because I feel like I have neighbors that are watching me, and that's basically the essence in the South, and that is it's a village. In the Missouri region, It's the middle part of the U.S. And so it's a bunch of, it's also kind of similar to the southern part, but also has more, how do you say, Amy? They're not different. It's not the South, but they're also about loving and hospitality. And then in the Northeast region, we basically have, when I went there, it was in the fall, and the colors, somebody reminded me from WorldWide that the beautiful fall colors, and it's true. They also have all the 4 seasons there, and they're just warm. The Massachusetts people are warm, and anybody that wants to go to New Hampshire, I want to be your friend because they have the best donuts ever. Can you tell them all about food?
Yeah, I mean, and I think every region has its own really, really great food. I am also from a different state from Maria, but from the South. And so we can fry anything here. In the South, you can fry anything, and it's really amazing. Okay, thank you, Maria, for sharing those with us. I know for all of you that have already gotten a job at National Healthcare, there are also questions that you have. And so Kimberly Cole is going to answer some of our questions from a case management perspective. So Kim, thanks for your time today too. So Kim, tell me, I know that we have lots of folks that have been hired, many people who have just signed a contract or a job offer. What is the first step once you've been hired, and what should you do if you're a new candidate just hired by National Healthcare?
Yeah, that is a great question. As soon as you sign your job offer, someone from recruiting will notify you and introduce you to a case manager. So if you're an RN, you'll go to an RN case manager. If you're a nurse aide, you'll go to a nurse aide case manager. This will be your point of contact, and they will reach out to you and introduce themselves as well as request your documents. This will be the first step in order to begin processing your immigration, is getting those documents in. So as soon as you get that welcome email with the list of documents, start gathering your documents, sending them to your case manager. Even if you don't have all of them yet, reply to your case manager, let them know, keep them updated so that they are aware that you're working on it, what documents you're still missing, so that they can prepare as well and keep notes in your file. So that is the first step that you'll want to do as soon as you're assigned a case manager.
Okay, awesome. Now, a really common question is, what is the timeline like? So how long does the immigration process take? Let's do for a nurse aide and for a nurse.
Yeah, for nurse aides and RNs, they're actually pretty similar in the process of timelines. It's approximately 18 to 24 months. But that also depends on how the government moves. Sometimes if they're a little bit delayed, it may make the process a little bit longer. Or if they're moving a little bit quicker, the process can go a little bit quicker. And it also depends on yourself as well. Are you responding to your case manager in a timely manner? Are you getting your documents in as well in a timely manner? If you follow along with your case manager, they'll keep you updated as soon as they get information or if they need something from you, and that'll help decrease your time as well. That'll help you move through the steps of the immigration process quicker. If we stay communicating, complete all of your necessary documentation in a timely manner.
That's great. And that makes National Healthcare happy too, because National Healthcare can't wait for all of the candidates they've hired to get here. They're really excited about that.
Yep.
What about common challenges? What are challenges that candidates face during the immigration process that they should know about?
Yeah, for the RNs, I think one of the most common challenges seems to be obtaining your visa screen and passing your IELTS or the TOEFL exam as well. So I would encourage you, if you're not studying now, to go ahead and start studying for that. Take your IELTS and TOEFL as soon as you can. Practice exams, do an online study or even a class setting and study those. And that'll help you, as soon as you get your visa screen, you can continue on with the process. So that's usually a holdup for the RNs. So I would encourage you not to delay working on those when you can, as well as for the nurse aides, they don't have to do a visa screen, but there will be times that the government can cause some challenges where they're a little bit delayed in processing. So we just have to wait patiently for them to process and do their thing, but your case managers will keep you updated for any information that comes through with that. So if you don't hear from them, they may not have any information yet, but always feel free to reach out and ask if they have any updates, as well as just keep in mind that this will be a long process. It can be. So continue to maintain your bedside experience, save as much money as you can. That'll help you be successful when you arrive, because you won't be able to work right away when you arrive, as there will be, you'll have to get your social security number. And if you're an RN, getting your license. Depending on the state, nurse aides may have to get their CNA license. So save as much money as you can. Just be prepared for that. If you have any delays or challenges, let your case managers know, and they will help direct you with what the solution is or how we can get around it. If you're getting married, having a baby, maybe you lost your job or getting a new job, I just advise you, keep your case manager informed always, because they are the ones that are there. They'll be your guide, your mentor, and they will help you every step of the process. So, build that relationship with them, and they will help you through it.
Thank you, Kim. I just want to echo that we here at WorldWide are here to support you. And we work very, very closely with national healthcare to make sure that for every step of your journey, we can have support and knowledge in place. We have an awesome onboarding department too that helps with the last piece and the travel and when you're ready for that. So from the very beginning all the way to the end till when you start at national healthcare, we at WorldWide will help support you through the process. So thank you so much, Kim. That's so helpful. So for those of you, what if you're on the call and you don't work for national healthcare yet, but you might want to, or you have friends or family who you would like to refer to national healthcare? What do? You are welcome to go onto our health staff, our website. You can apply. There's the link on the screen. There's also a recruiting email that you are welcome to email. I will say there are limited nurse aide spots remaining. So very, very limited amount of nurse aide spots, but we do have plenty of RN positions that are available. And we would love to help your friends come to the US with you and start this journey together. The other thing that you can do is right now there are recruiting folks that are live on chat. And so if you want to live chat with a recruiter right now, you're welcome to go to this link and it will take you to a recruiter who can help answer any questions you have in real time. All right. So I would like to introduce Tracy, who's one of our moderators today. And Tracy is going to go through and help us with some of the questions that have come in from you, the attendees in the chat, and see if we can help answer those.
Well, thank you. Thank you. Yeah, I'm going to bring up some questions here. You guys are bringing in some questions, and I'm going to try to share them with everybody. And going back to the food question earlier, when you mentioned the South, it's lunchtime in Southern U.S., everybody. No one mentioned barbecue in the South, and I was very surprised.
I'm so sorry. Yeah.
Okay. So anyways.
The best barbecue is in North Carolina. I'm so sorry about that, everyone.
Actually, it's the Mid-East. You remember, it's Kansas City, where Missouri region is.
I'd probably argue about.
We take our barbecue very seriously in the United States.
Yeah. Hey, if you're going to go to the Missouri region, yeah, we can figure that out.
And all right. So here's the first question. And the question is from someone who is asking about a CNA position or a nurse aide position. They're simply asking, am I eligible to apply for a nurse aide position? Now, Amy, you already mentioned that there's a limited number of nurse aide positions left, but I think this is a good opportunity to share what qualifications are needed for a nurse aide position.
Yeah, I think that is great. So, and really, we call this the Aide to RN program. And so, for the nurse aides that are being hired by National Healthcare, you heard Maria mention like their tuition assistance program and really their career development. And so, I think the plan for National Healthcare here is that nurses that don't have the opportunity to take the Nclex are able to participate in this program. And then once they get to the US, taking that Nclex exam is much, much easier. And so you'll have access to take the Nclex exam. So to be qualified for this particular nurse aide position, you would need to have the equivalent to a bachelor's in nursing degree and at least 2 years of current bedside experience. To make it, I think, as easy as possible to be able to take the Nclex. And then the great news is that once you pass the Nclex, you would be able to apply and interview for any open RN positions in the location that you are at for National Healthcare. And the likelihood that a position for an RN would be open is really good. So you would have the opportunity to go into an RN role really as soon as the Nclex is passed.
Thank you. Is there a timeline for when a nurse can start to take the Nclex exam if they've already applied as a nurse aide?
Yeah, so I think it depends. So you can take the Nclex whenever you want. Let me say that. You could, anytime that you want to take the Nclex, you are welcome to take the Nclex. I think there are different points in the immigration process where if you take the Nclex after a certain point, we wouldn't want to refile your immigration paperwork because it would slow you down instead of help you get to the U.S. faster. Once you arrive in the U.S. and plan to take the Nclex, I think we anticipate it'll probably be after you're here for 6 to 12 months. Because I think, Kim mentioned some of the things that you have to do, but you want to have permanent housing. If you have kids, you want to make sure they're settled into school. And then you want to make sure you're doing all of your preparation to be really prepared and successful on the Nclex exam. So I think, if you're thinking about a timeline for when you would take it in the US, we anticipate it will be between 6 and 12 months.
That's really helpful. Thanks. And Maria, this is a question for you. NHC question here. Does NHC offer career development? And can you expand on that?
Yes, NHC offers career development through our tuition reimbursement program, or even we're always training our people to become better leaders or moving up to a different position. And the example that I had earlier was that we have a person that worked in the dishwasher. She was a dishwasher and she wanted to be a CNA. So NHC helped her become a CNA. She wanted to be an LPN. From a CNA to LPN, NHC helped her. And then from an LPN to RN, and from RN to BSN. And then now in her career ladder, she was a charge nurse. Then she became a assistant director of nurses. Then she became the DON at a center. Then she became an assistant regional nurse. And then she became a regional nurse. And so that's a perfect example of a career development that NHC really supports. It depends on the drive of an individual, and NHC will be there to back you up.
Thank you, Maria. And this is a question for anybody. Which region in the United States has the lowest cost of living?
Ooh.
Well, that's sort of a hard question because there's, each state in the U.S. is very different. And the U.S. as a country is just really, really big. And then within each state, there's different regions and there can be really different cost of living in each state. I will give, and Maria, you tell me if I'm wrong here, but I will give a plug to the state of Tennessee. Tennessee does not have income tax. And so what you earn in Tennessee doesn't get taxed in the same way as it does in lots of other states. So I will say there's lots of really great reasons to live in the state of Tennessee. It's really affordable in general. There's lots of there's small towns, and then there's some bigger cities. You can sort of get whatever version of that you want, but you also don't pay income tax.
Yeah. I agree with that. And I think I can vouch for that because there's so many people from California now that are moving and driving. They're buying houses here in Tennessee. So yes, that's true, Amy.
Very good. Very good. I see a lot of how do I apply? I'm just going to move this slide over just to the this one again, just to share it again in case anybody needs to see if you're attending and still interested in applying for an NHC position. And you can go to healthstaff.org. That's our website, /apply-healthcare. But if you go to healthstaff.org, you'll see the apply button. Can't miss it. Next question. Can I bring my older children that are above 21 years old?
Now, that's a great question for Kim.
Yeah, I can take that. Unfortunately, 21 is the cutoff for children. The government has decided that is the cutoff. There are ways once you become a U.S. citizen. So after you're here as a permanent resident for at least 5 years, you can then apply to become a U.S. citizen. Once you become a citizen, then you can apply for your children that are over the age of 21. But unfortunately, only a spouse or unmarried children under the age of 21 can be included on your immigration petition.
Thank you, Kimberly. This is a question for you, Maria. Does a nurse aide enjoy annual leave, and roughly how many days, if they can ask?
So NHC actually has what we call earned time off, which is a vacation days, paid days off. And so you can use that however you want. For the first year, this is going to be my test if I remember it. For the first year, I believe you have an equivalent of 15 days off. It may be more than the 15. For some reason, that's in my head. It's been a long time. So about 15 days off. And so you can use that to go, I guess, travel if you want to travel. One thing about NHC is that this is how, for some, they might not like it, but I actually love it. And is that this is one way that NHC is really caring for their partners, is that if you don't use that 15 days, you actually stop accruing. And the message there is that use it. You know, most organizations, they'll allow you to save as many days you have. NHC does not, because we encourage our people to take their vacation time.
And Maria, I know that some other places, it's really common to work for a year and then take all of your time off, and then, not have additional time off. Can you talk a little bit about traditionally how paid time off works in the U.S.?
Okay, what do you mean?
So if you have 15 days off,
yes.
Do most employees at NHC take all 15 days at one time? Or what is really sort of common in how you use your time off in the U.S.?
Yes. So it's usually for most people in the U.S., I'd say 90%, the most that they take off is a week. Spring break, fall break. And then for those, like I have taken off from a Friday to the next Sunday. So it's about 10 days to go home to the Philippines. And so but I usually take, it's more than like a week or 5 days off of that 15. And so I think that's what you're trying, right, Amy?
Yes.
Yes.
All right, I'm going to bring up a couple more questions here, if that's all right with everybody. All right, next question. Here we go. And this is more of an application question, a new applicant. Do we need current nursing experience to be eligible? For example, I have 3 years nursing experience, but I have not been in the field since last July.
Yeah, that's a great question. So for nurse aide candidates, it does have to be current experience. It does have to be currently working. I think for RN experience, if you're on a break, that might be okay, depending on how long the break has been. But it is important that you immediately go back to bedside nursing, and during the immigration process, have a plan to continue just to keep up your skills and to make sure that when you arrive at national healthcare, you're up to date on, everything that's happened recently in the nursing field.
All right. Here's a good question about, let me just read the question. If you apply for a nurse aide position and you've been married for almost 8 years without children, but during the immigration process, you get pregnant, will this affect the process?
Kim.
Yeah. No, it will not affect your process. You can essentially add a child up until you arrive to the U.S. But obviously, as soon as you have the baby, we notify your case manager and they'll direct you on how to add them to the petition. We'll need to make sure we get a copy of their passport and their birth certificate. And then it's very easy to add them onto your petition so that they're able to come with you.
Excellent. I saw one question that mentioned if you're hired as a nurse aide and you're a holder of the diploma in nursing, can you end up as a RN? Nclex is the final determination of that, correct?
Yes.
Yeah, you will have to go through the application steps to take the Nclex. Once you pass the Nclex, then you can become an RN in the U.S.
Yep, good reminder. Premium processing. Has anyone mentioned premium processing today? Is that included?
For RNs, premium processing is included.
Okay.
For nurse aides, it is not at this time, but it is for RNs.
Good.
And if you're a nurse aide and, with National not providing premium processing, if you are interested in it, let your case manager know and you are able to pay for that. It is $2,500 and you'll be responsible for that fee, but discuss with your case manager and they'll help to answer any questions you have about premium processing.
Next question. Do people of different working experience enjoy the same benefits who are recruited by NHC within the same time frame in the RN or nurse aide positions? I think what they're trying to ask is, I think it's a benefits question. Can you break down the benefits differences between RN and nurse aides?
Okay, so the RNs will have a supervisory level of benefits. It's the same as far as the basic, the health insurance, all that, it's the same. But there's added items, I'd say, from on certain benefits for registered nurses in difference from an NA. It's the supervisory level benefits, but it will not affect the basic benefits of health insurance, dental, and all that stuff, and 401k.
All right. I'm pretty sure this is a question for Kimberly. I know we talk about the ETA 9089, so I'm going to bring it up. How long does it take the ETA 9089 to be approved after filing? Do you know the answer?
Yes. Well, sort of. So with the ETA 9089, that is filed and submitted to the Department of Labor. So now that is the first government agency that you'll be working with in the process for nurse aides. And as it's a government body, sometimes it varies on their processing times. It is taking approximately 6 months, we've noticed so far, to get a response from the Department of Labor. But like I've said before, as soon as we get an update, we'll let you know as soon as we hear back. But approximately 6 months from the date it was submitted to the Department of Labor, we should start seeing something.
Okay, very good.
Tracy, I think we probably have time for 2, maybe 3 more questions.
2 or 3 more questions coming up. Here we go. This is a shift question. How many hours per shift typically would a nurse aide work?
I'll answer that. So we have locations that are, the shift is basically 8 hours, and we have locations that the shift is 12 hours.
Thank you. Thank you. After the 3-year contract, can one stay on working?
Yes.
Absolutely, yes. That's what we want. We want commitment, lifers, like 30 years.
A willing 30 years. It's
Right.
not a contract.
Yes, absolutely.
Very good. All right, let's see if I can find 1 or 2 more questions, and then we'll wrap this up. I'm looking right now.
There's been a couple of questions about affordability of school. So in the US, wherever you may live, there's a public school system where attending school is free and from grades K through 12. So you will be able to afford school for your children. There are also other options for private school that you would be able to investigate depending on where you live. But school will always be accessible in the US.
Amy, can I add to that?
Absolutely.
I think that's one thing great. Like I said to you guys in the South, it's the village, and I have 3 kids and they're all grown. And they all went to the public school. And I know that in bigger cities, you probably want to have your kids in a private school, so that's an option. But that's one thing great about being in America, is that the public school system is great. So
very good, very good. Here's a little bit more of a specific question, but I think it kind of relates to an experience level that maybe a lot of attendees could relate to. The question is, hello, I'm from the Philippines, residing and working in Saudi Arabia. I have 4 years experience in an outpatient department in a clinic, and it's for checkups. Is that valid experience for a nurse aide?
I think that would make you eligible for an interview. And I think in the interview, the interviewer would explore, I think, some of your experience. And I think like Maria's talked a lot about commitment and care, and the values that national healthcare really looks for. And that would make the determination, but it would make you eligible for an interview.
Very good. Very good. One last question, everybody.
Yes.
Okay. Thank you. All right, here it is. We'll go with this one. May I know what processing expenses are included for reimbursement? What expenses are going to be covered?
Yeah, that's a good question. It'll vary between the RN process and the nurse aide process, as the RNs do have to take or complete the visa screen from CGF&S, so that will be a reimbursable fee. There will also be a medical exam that both RNs and nurse aides will have to take towards the end of the process, and that is reimbursable up to $400 of that fee. And so it's only reimbursable for the candidate. So your dependents, unfortunately, fees are not reimbursable for that, for them, but for you, most fees are reimbursable. But reach out to your case manager and they'll be able to provide you with the exact list of what is reimbursable.
All right. Well, thank you. That's the questions I'm pulling from the chat. And of course, the live recruiters are available in addition after the webinar, if you guys want to take a look at that.
Yeah, thank you, Tracy. So if you are currently hired by National Healthcare already, and you have other questions that we ran out of time to address today, like Kim said, please reach out to your case manager. They are going to be able to answer your questions even better because they know your personal situation, and they have all of your documents, and they can tell you where you are in the process or answer specific questions for you. And then if you have not yet applied, but you are interested, Tracy just mentioned again the chat. So there are live recruiters right now that can answer any of your questions if you have not yet been hired by National Healthcare. Or you can also go online and apply, or on our website at healthstaff.org or at recruiting@healthstaff.org. And if you have information for or if you'd like to refer a friend, you're welcome to send that information to recruiting@healthstaff.org as well. And we're super happy to have any referrals. And it's a great, I think Maria mentioned about how kind people are in the U.S. and how she has built a family in Tennessee where she is. But if you want to bring, if you'd like to bring some of your own people with you, we'd love to take your referrals so you can start that together. Okay, as we close out, Maria, we know that the NHC is really focused on helping all the nurses and nurse aides have a great first experience in the U.S. and like a great start as employees at National Healthcare, hopefully for 30 years. But what final thoughts would you like to leave with all of the guests that are on our webinar today?
NHC is an organization that has been here for 50 years and have sustained through the test of time with just like any other companies here in the United States. NHC is not just a business, it's in the business of caring for the geriatric population, which is the most vulnerable population here in the US. We need people that would love on them. We need partners that are really going to commit and going to be passionate about the care. So just like what I said earlier, if you're looking for a purposeful work, a mission type of work, NHC would be it because it's the focus on the patients. If you're also looking for professional career development for you to make your life better while you're here in the States, then NHC will be also the company for you. I guess NHC is a great company. It has been great for me and my family. But I hope that if I ever leave NHC, they could actually say that I made a difference, that because of me, lives are improved. So if you're looking for that kind of significance in life, then come join NHC.
Awesome. Thank you, Maria. I would like to thank all of our attendees for joining us today. We were thrilled to have you. Thanks to Tracy and CJ, our moderators who helped us put this together. And thanks to Maria and Kim for joining me today to answer all of your questions. We appreciate all of your time.